Welcome to NAFDAC and Your Health. My name is Tosin Omolaja. This is a program that brings you all the important information you need to know about NAFDAC. The agency is saddled with the responsibility of safeguarding our health by ensuring that the foods, drugs, cosmetics, and medical equipment made available to us are safe and wholesome. Today on the program, we join the world in marking the World Antimicrobial Awareness Week. Antimicrobial resistance, AMR, is a global threat to public and animal health, food security, as well as long-term development around the world today. AMR occurs when microorganisms changes and are exposed to antimicrobials. AMR develops naturally over time, mainly as a result of genetic alteration. In a bid to enlighten and increase awareness of the global threat, the World Antimicrobial Awareness Week, set aside by World Health Organization, World Organization for Animal Health, and Food Agriculture Organization of the United Nations, held in November.
Medicine Directorate staff just got trained by the Drug Evaluation and Research Directorate that focuses on human medicines, because it is the same premium. The fact that you're going to give it to animals doesn't mean that it shouldn't have quality. And bear in mind, if it is animal that we can use, the animal is just an intermediary between the human, the medicine and humans, because we're going to eat the animal. And if you eat the animal, you have drug residue. If it is used at a level that is too high, then the residue stays higher at in the animal too. And then when we take it, we run into problem. Talk of antibiotics. It leads to antimicrobial resistance, meaning you've been using amoxicillin, it was working, but after a while, it no longer worked. It's because of antimicrobial resistance, and it has killed so many people.
In understanding antimicrobial resistance, AMR, and its enormous effects on human health around the world, the Deputy Director, Veterinary Medicine and Allied Products Directorate, Dr. Idayat Mudashir, gives an insight.
AMR basically stands for antimicrobial resistance. And basically what it means in layman's language is that antibiotic resistance. So basically you're using an antibiotics, but it's not giving the desired response, because the antibiotics become ineffective. It's not treating what it has been administered to do. So basically what we need to understand is that AMR is no respecter of age, can affect anybody of any age. So it can affect young, it can affect old people. And then basically what AMR does is that it allows illnesses which would have been treatable for you to have a prolonged stay in the hospital and then having higher costs of treatment. And then we have cases of mortality, that's death, occurring. We have seen instances where antimicrobial resistance occurs naturally, but however, the misuse and the abuse of these products accelerates antimicrobial resistance, where you have people who are not using the dosage that has been prescribed for them. They either they're underdosing or they're overdosing themselves. So these are some of the things that actually will accelerate the effect of antimicrobial resistance.
In a bid to increase awareness of the global threats, the World Antimicrobial Awareness Week, set aside by World Health Organization, World Organization for Animal Health, and Food Agriculture Organization of the United Nations, held in November.
WAW is the World Antimicrobial Awareness Week. So this is a week that has been set aside by the World Organization for Animal Health and the Food and Agriculture Organization of the United Nations. The week has been set aside globally to try to create awareness on antimicrobial resistance. Basically, the awareness is targeted to different categories of people is targeted to individuals. You target healthcare providers. You target even the veterinarians in the agricultural sector. And then you also target even the policymakers and the MDAs like NAFDAC. So basically, we all have a collective role to play.
World Antimicrobial Awareness Week 2021 is a measure globally that is meant to create awareness. This year theme is Resist the Resistance. This case, the resistance are the microbes, and we are to resist the microbe, making sure that they don't build resistance. And this call of awareness borders on two major categories of the sector: the human health, call to the health practitioners, and the animal production and plant producers.
For individuals, the WHO has put up a 5 key for safe food. As individuals, you must ensure that your food is clean. As individuals, you must ensure that you keep your cooked food away from your raw food. As individuals, you must ensure that you cook thoroughly your food. And then as individuals, you must also ensure that you store food at the right temperature that it should be stored. Then as individuals, you should ensure that when you're cooking, you use clean water and you use clean ingredients or clean raw materials.
NAFDAC is working to raise knowledge about AMR across all aspects relating to public health so that users are aware of new alternatives.
NAFDAC activities on antimicrobial resistance cut across the different sectors of the country, the human health sector, the animal health sector, the food sector, and on farm too. The activities cut across from farm to fork, and what we basically do is to put in place some measures to combat the war between human race and the microbes. The antimicrobial resistance situation today is actually a war between the microbes and man, in that most of these microbes that are under control or check in the time past are no longer susceptible to the same drugs or medicine that are used on them. And then what we've done now is to ensure that the use of antimicrobial agent is controlled and is judicious and according to prescription. And what we mean by that is that you only use it when you need it, and you don't use it for things that will be able to strengthen the microbes in developing resistance. For instance, using antibiotics as a growth promoter is no longer allowed, so that we don't have a situation whereby when you give antibiotics in the feed, in a subladder dose, encouraging the growth of some class of bacteria that will aid digestion. Thereby, the one you are trying to suppress will be building resistance over time. And we've given a policy on that, and we are monitoring that. We are ensuring that nobody use antibiotics as growth promoter. There are alternatives. You can use enzymes, organic acid, probiotics, prebiotics in feed. And the campaign so far has been encouraging, and the people that are yielded are equally making us to know from the feedback that it's even cheaper to use other alternatives apart from antibiotics. Another thing we're doing as agency is to ensure that biosecurity are in place on farms. You put measures in place to combat microbes, the invasion of microbes on your farms, not only in animal farms, even in plant farms, agronomy, people that plant vegetables and citrus and other crops. If you have biosecurity measure in place, the microbe will not infect your animal or your crop, and you will not need antimicrobial agent to combat them. Then another thing we stress is the use of vaccination for animals. If you vaccinate your animal and you maintain the vaccination regimen for the animals, obviously they will build immunity against some of these pathogenic organisms, and you may not need to be treating those infections again, because the infection will not even come up at all.
We'll take a short break now. We will be back. Don't go away.
Hello, my name is Oluwadamilola Abiodun Adewusi. I'm a veterinarian and epidemiologist with the National Agency for Food and Drug Administration and Control, NAFDAC, where we are saddled with the safeguarding of public health. I recently started the Fleming Fund Fellowship Program, and I'm in the Antimicrobial Use Consumption Surveillance Stream for Human Health. My host institution is the National Food Institute Technical University of Denmark. What are antimicrobial drugs? Antimicrobial drugs are chemical substances of natural or synthetic origin that suppresses the growth of or destroy microorganisms including bacteria, fungi, helminths, protozoa, and viruses. Examples include antibiotics, antifungals, antiprotozoa, and antiviral drugs. Since their discovery, antibiotics have served as the cornerstone of modern medicine. However, the persistent overuse and misuse of these drugs in human and animal health have encouraged the emergence and spread of antibiotics resistance, which occurs when microbes such as mycobacteria become resistant to drugs that are used to treat them. Researchers have explained that major causes of antimicrobial resistance in microorganisms from human remains the use of antimicrobials in human medicine, in the community, in food, animal production, and in the environment. While limiting my talk to human use of antimicrobial as a key driver of antimicrobial resistance, the combination of overuse and underuse in many parts of the world, with Nigeria inclusive, has resulted from its usage for minor infections such as cold and flu, inappropriate treatments, for example, overusage, self-medication, transfer of leftover antimicrobials from one person to the other, and its underuse due to transient relief from ongoing infection. All these have been reported and have been perpetuated by each and every one of us, involving in prescribing, dispensing, in the community, and also in the healthcare, and also because of some health system factors. What are the dangers of misuse of these antimicrobials? Taking antimicrobials when they are not needed accelerates emergence of antibiotics resistance, and which is one of the biggest threats to global health. When antimicrobials become resistant, common sicknesses will no longer be treatable. Antibiotic-resistant infections can lead to longer hospital stays, higher medical costs, and even more deaths. If you rarely take antimicrobials, if you said so, you can still be infected with a resistant strain. So what are the precautions to be taken? Avoid infections by washing your hands properly and regularly, preparing our food hygienically, practicing safe sex, keeping your vaccination up to date, etc. We should also carry out laboratory analysis when we are sick to ascertain which antimicrobial is appropriate. We should also limit contact with others when we are sick. Mind you, not all infections are treatable with antibiotics or any of the antimicrobials. Antibiotics don't cure viruses like cold and flu. Antibiotics are not always the answer, so do not demand for antibiotics if your healthcare professional says you don't need them. Only take antibiotics prescribed to you and do not share leftovers with your family and friends. Always seek the advice of qualified healthcare professional when taking antibiotics. Avoid purchase of antimicrobials or antibiotics from hawkers and unregistered drug outlets. Remember, the future of antibiotics depends on all of us. Thank you.
Welcome back. If you are just joining in, you're watching NAFDAC and your health. In an attempt to strengthen the fight against AMR, the National Agency for Food and Drugs Administration and Control, NAFDAC, forms alliance with other agencies.
NAFDAC as an agency, we collaborate with sister agencies nationally, and we also collaborate with international bodies as regards our fight against antimicrobial resistance. Lately, we participated in Codex Task Force on Antimicrobial Resistance, and we developed 2 documents, Code of Practice and guidelines. And from those documents, by the time it's being passed by Codex, we have a good document to work with in ensuring that the professionals practice according to the ethics of their profession in mitigating against antimicrobial resistance. And the guideline is going to enlighten us on the procedure, the standard procedure we're to engage in handling uses of this antimicrobial agent, so that we'll be able to prevent the possibility of them building resistance against us. And at national level, we are a member of One Health Concept Desk, which domiciles at NCDC, that's the Nigerian Center for Disease Control. NAFDAC is represented on that committee, and then we're working according to the National Action Plan, and all the action plans that leverage on NAFDAC mandate are being observed, incorporated into the agency work plan, whereby we put up all different measures to combat antimicrobial resistance. Chief of this is the enlightenment, creating awareness, and making professionals to know that antimicrobial resistance is with us, is a global menace that we must combat. When that awareness is there, then we can bring to fore our expertise in ensuring that all these microbes will not invade us unaware, but we put them in check and make sure that we control them.
Beware. Fake or damaged drugs have put many people in serious health harms and have killed many others. But you can protect yourself by seeking professional healthcare advice when you feel unwell. Buy drugs from only licensed pharmaceutical outlets and make sure you check the packaging for poor condition, spelling errors, and unclear labelings. Also, check NAFDAC registration number, batch number, the expiry date, manufacture date, and manufacturer's address before paying, and always collect a receipt. If you suspect a drug to be fake or damaged, report immediately to NAFDAC on 0800-162-3322 or send an email to sf.alert@nafdac.gov.ng. Protect yourself and your loved ones. This message is brought to you by NAFDAC with support from WHO.
Time now to bring you our bulletin on NAFDAC's activities over the last week. That's on NAFDAC Updates.
NAFDAC calls for reduction in salt intake. NAFDAC calls for reduction in salt intake. The National Agency for Food and Drug Administration and Control, NAFDAC, and other stakeholders have called for a reduction in salt intake to avoid the growing risk of cardiovascular disease. This call was made at the Nigeria Sodium Study Stakeholders Meeting held at the University of Abuja. The program was organized by Nigeria Sodium Study in collaboration with the Cardiovascular Research Center, University of Abuja, George Institute for Global Health, NAFDAC, the Federal Ministry of Health, and Northwestern Medicine, Feinberg School of Medicine. NAFDAC Director General Professor Mojisola Adeyeye urged the food industry to voluntarily reduce the amount of salt in products amid a growing epidemic of preventable diet-related conditions. She said habitual consumption of excess salt may seem harmless, but it is linked to several non-communicable diseases which are prevalent in Nigeria. The Vice Chancellor of the University of Abuja, Professor Abdul Rashid Naala, lamented that Nigeria has so many problems and the dangers of taking excessive salt are one of them. While cautioning people against the consumption of salt and other sodium products, he said working with NAFDAC will definitely make a difference for Nigerians. NAFDAC and DSS officials go after COVID-19 vaccine racketeers. The federal government has inaugurated a joint task force to check the activities of COVID-19 vaccine racketeers. The executive director of the National Primary Healthcare Development Agency, Dr. Faisal Shuaib, disclosed this during a ministerial press briefing on COVID-19 held in Abuja. Shuaib, who was represented by an official of the agency, Dr. Bulama Garba, said the agency, alongside security agencies, will make sure compromised health workers are apprehended. He said, "We have launched a joint monitoring task team to arrest and check the activities of COVID-19 vaccine racketeers, including people who are attempting and compromised health workers who issue vaccination cards without giving people the vaccine." According to him, a team comprising of operatives of the DSS, NAFDAC, and MPHCDA are sounding a warning to health workers. Health workers who are caught will be arrested and prosecuted. NAFDAC embarks on post-conflict recovery of agribusinesses. The National Agency for Foods, Drugs Administration and Control, NAFDAC, has said it will champion the post-COVID and post-insurgency recovery of agro-allied businesses in northeast Nigeria. The Director General of NAFDAC, Professor Mojisola Adeyeye, disclosed this in a statement released and signed by the agency's resident media consultant, Shayo Akintola. According to the DG, the agro-allied industry was one of the worst hit by the insurgency and economic downturn of the COVID-19 era. She explained that the agricultural sector, which accounts for about 90% of the economic life of the people, was brought to zero in states like Borno, Adamawa, and Yobe, especially in Borno, where the heat of the Boko Haram insurgency was mostly felt. Professor Adeyeye stressed the need for investment in the sector, saying the investment of Borno State government in the sector will enable the introduction of new micro, small and medium enterprises. She said the MSMEs will be involved in the processing, packaging and preservation of agricultural products, all of which are under NAFDAC mandate. That's it on NAFDAC Update. You've been updated.
Here's where we draw the curtains on this edition of the program. Join us same time, same station next week for another informative package. In the meantime, if you have comments, complaints, or you want to report activities of fake drugs or adulterated food product peddlers, our doors are always open. You can reach NAFDAC via toll-free numbers. For inquiries, call 0700 162 3322. For complaints, call 0800 162 3322. You may also email NAFDAC at nafdac.gov.ng. If you have complaints about any form of misconduct, you can reach the Reforms Unit via email reforms@nafdac.gov.ng or call the Reforms hotlines on 0909 763 0506 or 0909 763 0507. NAFDAC, customer focused, agency minded. NAFDAC prioritizes customer satisfaction, which is why our motto says we are customer focused, agency minded. Kindly visit our website to fill a short customer satisfaction survey to help us serve you better. COVID-19 is real. Please ensure you and your family follow the safety measures as outlined by the NCDC. Stay away from crowded places as much as possible, and if you must be out there, please wear a face mask. Wash your hands regularly with soap and water, and ensure you use only NAFDAC-approved alcohol-based hand sanitizers. See you next week. Stay safe.